Welcome to the Repugen Podcast, where we transform patient care.
Welcome back to another episode of the Repugen Podcast. I'm Jennifer.
And I'm John.
Today we're covering why fake reviews are becoming a healthcare reputation nightmare.
Yeah, and this is such a critical deep dive for us today. I mean, we are really exploring why both fake positive and fake negative reviews are just, well, severely damaging healthcare credibility.
Right, and why proactive monitoring is basically vital now if you want to strengthen that digital trust. Because think about it like this. Imagine walking into a highly recommended surgeon's office, right? The waiting room is pristine, the staff is welcoming.
That's a pretty great start.
Exactly, but then you look closely at the wall and you realize the medical diploma hanging there was just printed off the internet.
Oh, wow, yeah. That would instantly shatter your confidence.
Right, it is a total psychological whiplash. And that is exactly what happens when you discover a doctor's 5-star online review is, well, completely fabricated.
It really is. And the stakes are huge here because, 89% of you check online reviews before even booking a medical appointment.
Yeah, because we don't know the medicine ourselves.
Exactly. Since you don't usually have the medical background to evaluate a doctor's clinical skills, you rely entirely on what we call borrowed trust.
Borrowed trust. I really like that term. But that borrowed trust is, it's kind of collapsing right now, isn't it?
Oh, absolutely. I mean, Google had to remove over 240 million fake reviews in 2024 alone. 240 million.
Wait, in just 1 year? That is insane.
Just 1 year, yeah. And we were looking at two major threats here. On one side, you have AI bot farms, or people just buying thousands of fake positive reviews to artificially pump up their ratings.
Okay, and what is a second threat?
Well, on the flip side, you have fake negative reviews. These usually come from aggressive competitors or, disgruntled people who are never even patients, and they're just trying to deliberately sabotage a clinic.
So, because the platforms clearly couldn't control this, the regulators are stepping in now, right?
Yeah, they had to. As of October 2024, the FTC introduced a rule that outright bans fake and AI-generated reviews. And they're on not messing around with the penalties.
Right, I saw the numbers on this. It is a staggering $51,744 penalty per violation, right?
Exactly, per violation. So providers are legally forced to actively monitor and manage their online presence.
But wait, I have to push back on this. This seems like a massive, basically impossible trap. How can a healthcare practice combat fake reviews and respond to patients online without violating privacy laws?
It is definitely tricky.
Because if a clinic actually responds online and acknowledges a patient, haven't they just broken HIPAA laws? How does anyone survive that catch-22?
Is the ultimate tightrope walk, yeah. To survive it, any public response to a review has to be strictly HIPAA compliant.
So what does that actually look like?
Well, you can post a professional reply to show you are attentive to feedback, but you absolutely cannot confirm the reviewer was ever a patient.
Okay, so you never confirm the relationship.
Never. And you certainly cannot mention any protected health information. It is all about signaling to future patients that you care while staying totally HIPAA compliant.
Okay, but if navigating a public response is basically a legal minefield, how does a clinic realistically defend itself? Like, what is the antidote to a sudden wave of bot-generated one-star reviews?
The most effective shield isn't fighting every single fake review individually. It's burying them under a massive volume of authentic reviews.
Because of social proof, right.
Exactly. The psychology shifts when the numbers get high enough. The data shows that 56.8% of patients will actually prefer a provider with a 4.5-star rating and 1,050 reviews over someone with a near-perfect 4.9 rating, but only 25 reviews.
Oh, that makes total sense. It is like listening to a massive choir. If you have 1,000 people singing beautifully, one off-key singer, like a fake negative review, just gets drowned out completely.
That is a perfect analogy.
But if it is just a trio, right, one bad note ruins the entire performance.
Yeah, exactly. And that high volume signals statistical safety to you, the patient. You subconsciously realize 1,000 people can't all be wrong.
Right.
And this is why proactive management is so vital. Practices are turning to tools like Repugen to systematically and automatically gather authentic feedback right after a visit.
And Repugen also flags review risks early, doesn't it?
Yeah, it flags risks, and it helps automate those tricky HIPAA compliant responses we talked about. It shields the practice's privacy while building up that protective volume of real voices.
So if you are running a practice, it is time to stop letting a printed off the internet reputation dictate your patient volume. You can take control right now by visiting Repugen.com to book a free demo and start securing your online credibility today.
Definitely, because ultimately we have to stop viewing an online reputation as just a marketing tool.
Yeah, it is a clinical asset. Think about the downstream effects. When a patient's trust is rattled by a suspicious digital footprint before they even walk in the door, they are already on the defensive.
That is so true.
They become way more likely to second-guess a diagnosis or delay life-saving care altogether. If your digital waiting room is compromised by fake voices, does the actual medicine even stand a chance?
It really doesn't. Trust is everything.
Thanks for listening to the Repugen Podcast, your path to better healthcare.